After struggling myself to turn off 3 alarms, I wake up at 8:30 am. I know it's late, but you will know at the end of the video that why I wake up late. So I quickly get ready because I have to reach hospital at 9 am.
Hello everyone, my name is Akash Mangukiya and welcome to my channel. I'm 4th year medical student and I'm doing my clinical rotation at Kathmandu Medical College and Teaching Hospital. And also I'm preparing for 2022 June fmge exam. And today is my first day of radiology. Let's see how it goes. So before we start the day, if you haven't subscribed my channel yet, then do subscribe my channel. It's gonna be exciting. So this video is gonna be my first day of radiology and study with me for fmge 2022 June exam. So without any further ado, let's start the video.
So after getting ready, I ate some banana chips as a breakfast and I left for the hospital. So since this is the first day, I need to get the HOD letter, which is a letter to the head of department to let him know that I'm gonna be joining radiology for 4 weeks. So right now I'm going to the administration to get the letter, but administration is far up in the 4th floor, so I have to climb all those stairs. And you can see the airport from the top of the hospital and it makes me wanna go back to India. So after 10-15 minutes I get my HOD letter and I also ask for the clearance paper as I am finishing at the end of the December. So I quickly put my clearance papers into locker and head directly to the radiology department with that HOD letter. I directly went to the USG room where I met the head of the department and he told me to see USG with other consultants. But from there I got sent into CT scan room with one patient as we couldn't rule out the abnormalities in ultrasound. So I went with the patient and I saw how the CT scan is done. I loved how they operate the CT scan machine and it makes me wanna sit on that chair. As you can see, we can see the organs far better than the ultrasound, but CT scan has its own flaws. CT scan is also a gold standard investigation for some medical emergency like stroke and head trauma to rule out the blood accumulation in intracranial space. As you can see the brain scan of different patient. I again got back into the USG room where I learned the types of probes that we generally use. As you can see here, this is the antenatal scan of baby and we can see heart moving in the USG image. Immediately after the USG, we have to make the report of the patient precisely as in the video, sister is making the report ready for the patient.
So I learned in prenatal scan that how to recognize the heart, how to recognize any septal defect, how to recognize the face, how to recognize any cleft palate or any cleft lip or not, or any brain abnormality or any spine abnormality there is or not. We also have to check there is 2 arms and 2 legs in the fetal. And also I have seen case of cholelithiasis, nephrolithiasis, pancreatitis, bowel obstruction and liver cirrhosis and appendicitis. Also I have seen the dermoid cyst in the ovaries and how it looks like in the USG. And this is really amazing to see that we can actually see the organ inside our body. No one has thought of that we can actually see the organs inside the body in 150 years ago. This is really amazing. People think that USG is really hard to recognize, but once you get a grip on it, it is easy to recognize every structures of body. And this all can become easy if you read the notes while you are in your posting. So it is really easy for me to recognize every structure because I am reading the notes of marrow with it. So the marrow notes is really been helpful for me.
So after that little talk, I went back to hostel.
So just got back from the hospital and it was really amazing day, I have to say that. So first I will change and I will explain to you. So today I was just sitting in the USG room. So they taught me how to see different structures of the human body like liver, spleen, kidney, bladder, gallbladder, uterus, ovaries, fallopian tubes. And I can say that I will recognize those structures if I see those structures in USG or in photos without even any help. So today was just USG and I have 4 weeks, so I will see more of X-rays and CT scan too in further days. Right now I will go and have my lunch and I will start studying. Okay, so just had my lunch now and let's start studying now.
So right now I'm watching BNB videos and I'm making the notes with it. So I usually study in 45 minutes block and 15 minutes break. I know it's bigger break, but that's what works for me. As you can see, BNB video is running on my screen and I'm annotating extra information in BNB PDF itself. I'm just annotating because time is very crucial at this point. If I write down everything, I will just waste my time. So this is not right time for writing everything down, so you have to be smart here and study smartly. So after watching the BNB, I annotate in the first aid, and this is the best way to study first aid. I can say that if you want to study first aid, study with BNB. It will clear your concept and give you better understanding. And first aid is not only for the USMLE examination, it will be helpful in your FMG or NEET, or you can say next examination too. So now I have just wrapped up some topics from BNB and first aids, and now I will have some sleep for 1 hour and I will start studying again. So after waking up, I didn't feel like studying, so I opened up Netflix series Queen of the South and I watched 1 episode of that, and then I again started studying. So right now I'm doing is Marrow, and small screen is open for Marrow, and under the notes that I have downloaded from Telegram, I have opened in the Samsung Notes. So whatever he is teaching, I am just highlighting it, or whatever I feel that this is extra information, this is not in the notes, I will just write it down in the notes which have extra space for writing. And right now I'm studying cardiology, which has taught by Dr. Akash Nair, and I have to say that he has done an amazing job to teach this all. And also I want to say that right now I'm in radiology, but I have done my radiology from Marrow already, so I will just go through the notes when I will go tomorrow for my posting, and that's how I will revise it also, and then I don't have to look it up, or I will just go through briefly when exam will be near. And also I have to show you guys that I have made schedule in my tablet date wise, that this date I will do this date I will do this. So it is in my mind that in what days I have to do this chapter or do this topic. So at the end of my MBBS, I will know that what topics I have left to cover and what topics I have to give more time, and what topics I have to give less time. So I will recommend you guys to make schedule on your own. So I will see you guys when I will go for my dinner. Until then, enjoy the video. So right here in this video, I'm doing the Q banks, and whatever the questions I get wrong, I'm writing it down so I can revise it later. And I wouldn't have to look through all those questions because I noted down the wrong question in my notes. So when I will do question bank for the second or third time, I can get 90 to 95% of the question right. So after studying all that, we went out for dinner.
So I just came back from the dinner, and I will just do my radiology revision first, and then I will go through the pathoma chapters, and then I will fall asleep. So enjoy the video. Make sure you hit the like button and subscribe the channel, and comment down below how your preparation is going on for FMG 2022. I will see you guys in the next one. Until then, bye bye.
At the end of the day, I revised radiology Marrow notes and did pathoma chapters. I'm doing pathoma because it has given every explanation in short, so I can revise all pathology of organs in just some hours. So I did those chapters until 3 o'clock. Because of that, I wake up late in the morning because I stretch my studying in the night because I'm not really a morning person. So thank you everyone for watching this video. Good night to you all.